everyone, Avalon here. My first topic is going to be a very important term that we've used in healthcare for years. It's called informed choice. Informed choice basically means that the doctor has come up with a diagnosis. Say, for instance, let's use an easy one again. Let's go back to back pain, okay? So your diagnosis is back pain, and wherever it's located, low back pain, mid back pain, or basically just back pain or neck pain, okay? Those are all very important things, okay? As a result of the fact that you have to have a diagnosis so that we know how to treat. And informed choice is about your choices of treatment. So let's just use an example of, let's use neck pain, okay? All right, so I'm going to inform you on different treatment choices for neck pain. First of all, you're going to have to go to either a doctor of medicine or a chiropractor of medicine to give you a diagnosis of where the pain is located and why. Some chiropractors will want to do x-rays, some won't. Most physicians need to do x-rays but don't. Therefore, that's a little bit of informed information I'm giving you right now, is that how do you know? Like, you go into the doctor, you say, my neck hurts, doctor, right? So if he doesn't do an x-ray or she doesn't do an x-ray or anything, right, to prove it, doesn't touch your neck, doesn't even touch your body, but you leave your office visit with a diagnosis of neck pain, and you actually have neck pain, you're actually doing pretty good. Because there's a lot of things going on lately to where it's like you may go in for neck pain, but you leave with a diagnosis of low back pain. You could see where there could be a problem with treatment. I could be saying to you, but wait, I don't want to go to a surgeon for my neck pain. I need to go to a surgeon for my low back pain, if surgery is an intervention choice. So basically, the diagnosis of your condition is related to what you're going to tell your person, your physician, your chiropractor, your midwife, your whomever, okay? And all of those things need to be taken into consideration for your person, your healthcare provider, to give you a proper diagnosis. Without a proper diagnosis, you can run into all kinds of problems if you do not have informed choice or education. Because you could think the doctor thought, when he said back pain, oh, he got me, I have neck pain. But in your chart, your documentation of treatment, it could say low back pain. What if you don't hurt in your low back? What if you hurt in your neck? What if you were sent for a consultation for surgery for your low back pain, but you've been trying to tell your doctor it's neck pain? You could see where you could run into some big deal problems there. Because I've actually spoken and seen a lot of people, because they're confused, get, and obviously so, because they're not educated, to getting a surgery or a spinal pump for pain in their low back, which they're hoping upon hopes will help their neck pain. But instead what it does is it does nothing for the neck pain. Instead, it gives you an intervention, a surgical intervention, which opens you up to all potentials for, like, hospital infections, infection alone, not treating the diagnosis. Like, what will I do with a 6 to 8 week surgery for low back pain if my low back was good, but nothing was done to my neck to show me that they heard me? So I think that's pretty much the first thing that we need to talk about, is nobody really talks to you. Nobody really listens. And as your person who's a healthcare provider, you are my patient. You are the person coming to me for help. So you need to know what is wrong with you. I'm sure you do. But we have a problem with communication for some reason, to where you could be talking about the neck pain, but you leave there with a low back pain diagnosis. Now, the first thing I want you to learn from this educational video is that every office visit you have with a physician who you are paying to take care of your physical body, or emotional, or whatever, we'll get there. But let's just say now back pain. I want you to make sure to get a copy of that daily visit. It's very important to know what your doctor's diagnosis is, because it will be what they will treat you with for, it will be what they send you out for referrals for, it will be used for whether or not it does not get fixed and you have to go in for a disability claim. So let's just say you have neck pain, but they do surgery on your low back pain because you're thinking they may know something you don't, right? Maybe the low back pain surgery will help your neck. It doesn't. So that's why it's really good to have information about the fact that you really want to focus in on A, your diagnosis, and B, your charting, the documentation done at that visit. Because you're going to have to look at that and ask yourself when you read it, did he hear me about my neck pain? How did I get low back pain? Because that can follow you for years and years and years and cause many, many bad interventions. Like, for instance, the example I gave, a surgery that was for not the problem. So that's the point of the educations of these videos, is to help us to start to think about our responsibility in our own health care, because no one else is caring unless you get really lucky and get a doctor that cares, which I can go into that on another video. But for right now, it's kind of urgent because there's so many doctors out there not focused on your diagnosis, not focused on your illness, not focused on your problem. Unfortunately, they're focused on other things, but that's not the point of this video at the moment. I want us to know you have the right for your medical documents, so you can look them over to see if that doctor listened to you. Because if he did not listen to you, and he gave you a diagnosis that just for you just does not make sense, it doesn't make sense. You're right. Do not go back to that doctor. You have every right, insurance or not, to go in for a second opinion. So in this series, we're going to work on either getting to a bullet point where we go right in, we get the doctor we need right off the bat, or learning trial by error. But keep in mind, we're dealing with life, your comfort, perhaps even your death. So anyway, that's the first of whatever the hey this channel is going to be about, is education. And I'd love to hear from you guys what you want to learn about. And eventually I may or may not have a PayPal button. I may hook this up to a website. I don't know, but I am passionate about the issues I see coming up with our current health model that has no health care or any, like, anything that makes sense care to it, okay? And perhaps you'll get this later, but it doesn't matter. Right now, I want you to find out what is the diagnosis your doctor's treating you for. Because if it's not fixed in 4 months, it becomes chronic. And chronic means you're going to be sick for a long time. Let's prevent that.